we know that there's still widespread stigma, widespread problematisation of women's bodies in the workplace across a number of life course issues, menopause being one of them. But also it's uneven in terms of what bodies we're looking out for. So one of the challenges has been developing policy or developing practices that works for all bodies. And that's not just white women's bodies in professional white collar roles or office based roles, but women who are, in healthcare, working lone workers, working out in the community, women who are in low paid, precarious jobs. We know that they're less likely to disclose. So we know that in low paid jobs, people are less likely to disclose menopause. Menopause is what we call an experience that's shrouded by gendered ageism. So that kind of coming together of gender bias and age bias. And we know that gender is has an enduring tenet around inequality, but also age does as well. So we know there's huge challenges there. So, for example, I was involved with the World Economic Forum in 2024, and they identified the ageing workforce as one of the most important grand challenges we have. And we know that if we can tackle that, that's going to add around 28.6 billion value just to the Australian economy alone. So menopause is part of that broader conversation around having age-friendly environments. The third trend that we're starting to see is how do we effectively, for want of a better word, mainstream menopause? And that's been something I've been particularly passionate about, because I think if we keep menopause in exclusively the ED&I or the wellbeing space, it's not going to be embedded, and we're really going to lose the opportunity to support what is a huge talent pool in our workforce, who are highly engaged, highly resilient, and have so much to give economically and also socially as well. So workers feel they want to have the choice over disclosing. And I think that's really important, that choice piece, because some employees feel that it is a private issue, that they don't want to discuss it in the workplace. And I think it's really important that we make sure that there are policies in place that they can access without feeling that they're outing themselves around menopause. I always say that if you've got £50,000, invest 40,000 of it in line management training, because if you've got your line managers ready and good to go and feeling supported, then they will create the enabling environment for you. They will make your transformation.
One of the other stats I remember from that study you did was something like about 70% will say, yes, I am impacted by the symptoms. So just kind of confirming that it's impactful. That was about 45% said that the workplace impacted my symptoms. And to me, that's where the huge opportunity is, isn't it? Finding out what are those workplace factors that are making it worse for you, and therefore how can we shape our environment differently?
Absolutely. I mean, I think the idea of, is your environment hospitable or inhospitable to menopause, but also to midlife women, who are the people who usually experience menopause, of people who feel supported by their line managers, will, all things considered, will report less problematic symptoms. And that's really important, because what we're saying is it's not that it changes the physiology, but it changes the way that whether they perceive them as bothersome or not. So the example would be, the ubiquitous hot flush. If you're in a workplace and you feel that you can kind of, mention it, take 5 minutes out, take off a bit of clothing, and it's not an issue, that's a less problematic symptom than if you feel you're trying to cover it up.
Really, then you're trying. I know one of my concerns have been that these negative impacts on the workplace are all attributed to menopause symptoms. But I say, no, it's the symptoms in the context of silence and lack of support, and they're modifiable factors.
100%. And when I'm working with organizations, I'll say, a menopause friendly environment is a friendly environment for everyone. And what you actually find, and this is anecdotal from my experience of working in organisations, not from evidence-based studies, is that when you start talking about menopause, you start looking at more disclosure around mental health, and particularly around men's mental health and depression in mid to later life, around aspects such as prostate issues, if people are experiencing early onset dementia, or kind of midlife cognitive challenges, and all those kind of other complex midlife issues that are often shrouded in stigma. And I think that's a really great outcome because we know that if you're talking about menopause, people are more likely to disclose and talk about other, you know,
Mhm.
what I can say is bodily changing body challenges and body experiences. So it works. It's great for everyone. So. Line managers are very much like general practitioners in healthcare. They want to help people. They're first responders a lot of the time, but they're first responders for a lot of things. Their time is limited. They're doing a million other things as well. They've probably got a job as well as line managing, and I think it's really important that as an organisation, we make it easy for them. We make it a one-stop shop so they know what they've got at their disposal. One of the kind of ongoing aspects that's up for debate is about menopause leave. And there's actually not a lot of systematic evidence that suggests that menopause leave does work vis-a-vis the investment. I think my position, and this is my take, and I'm very open to others having other perceptions, is that I'm quite ambivalent about it because I think on the one hand, it can be for many, it can be a career saver, but we have to rely on managers and organisations using it responsibly. And all too often, what I found is that menopause leave and other forms of leave is used to displace women from the workplace. So it's like it gives managers the excuse to say la la la, too much information, I'm not going to think about this, I'm just going to say yes, you can take the leave. And that's not great for the workplace, it's not great for women's careers. It's not great for gender equality or talent management. So menopause support groups, we know that they're very effective in organisations when they have resources. So I've just finished some collaboration with the Menopause Cafe, which is a large movement around basically women getting together and talking about menopause. There's a lot of menopause cafes in workplaces, and we found that yes, it has a significant effect on health and well-being in a positive way. Fantastic, but if they don't have the resources to support them, it's likely to fritter out. So I think don't assume who your allies are going to be because I've been in situations where we've had women who've clearly had lived experience in menopause and they've said, well, I've breezed through it, so what's the problem? So and then I've been in organizations where we've had fantastic male young colleagues who because of their vicarious experience with a significant other, like their mother or their partner, are huge advocates. The challenge is as an organisation, we're relying on their lived experience in order for them to become allies, and that's not sustainable. And it's never too late to start, and it's never too soon to develop. And